Hand and finger joint pain is one of the cruelest kinds of pain there is, because it does not just hurt, it steals. It steals your ability to open a jar, to button your shirt, to hold your grandchild's hand without wincing, to type a message to a friend, to play the piano, to do the needlework you love, to shake someone's hand without dreading the pressure. Every single thing that makes your hands useful, expressive, and connected to the people and activities you love. Hand and finger joint pain takes away piece by piece. And most people accept this as inevitable, as just the way things are going to be from now on, but it is not inevitable. And today I am going to show you one simple morning drink, made from 3 powerful clinically researched natural ingredients, that is giving people their hands back, their grip back, their freedom back in just 14 days. And the most beautiful part? You can make it in your own kitchen in less than 3 minutes starting tomorrow morning. And before we go any further, if you know someone whose hands are failing them, someone who winces every time they pick something up, someone who has stopped doing the things they love because their finger and hand joints just will not cooperate anymore, pause this video right now and send it to them immediately, because what we are about to share could genuinely give them their hands back. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed, and life-changing health information that your doctor probably never had time to explain. This community is growing every single week, and I do not want you to miss a single video. Now let us get into this, because your hands deserve better than what they have been getting. Let us start by understanding exactly what is happening inside your hand and finger joints when you experience that chronic daily pain and stiffness. Because once you understand the biological root causes, this morning drink and everything in it makes complete and perfect sense. Your hand and finger joints are among the smallest and most intricately constructed joints in your entire body. Each finger contains 3 joints: the distal interphalangeal joint at the fingertip, the proximal interphalangeal joint in the middle of the finger, and the metacarpophalangeal joint at the base of the finger where it meets the hand. Your hand itself contains the carpometacarpal joints connecting your fingers to your wrist. All of these tiny complex joints are lined with a tissue called the synovial membrane, which produces synovial fluid, the lubricating substance that allows your joint surfaces to glide against each other smoothly and painlessly. When hand and finger joint pain becomes chronic, it is almost always driven by 3 interconnected biological processes happening simultaneously. The first is synovial inflammation. The synovial membrane becomes irritated, inflamed, and swollen, producing excess fluid that causes that characteristic puffiness and swelling around your knuckles and finger joints. This inflammation releases destructive enzymes called matrix metalloproteinases that actively break down the cartilage lining your joint surfaces. The second process is cartilage degradation. As cartilage breaks down in these tiny joints, the bone surfaces begin to lose their smooth cushioning, and the joints become increasingly painful, stiff, and restricted in their range of motion. The third process is nerve sensitization. The nerves surrounding your hand and finger joints become hypersensitized by the chronic inflammatory environment, meaning they fire pain signals in response to stimuli that would not normally be painful at all. This is why even a light touch, a gentle handshake, or simply the weight of a blanket on your hands at night can feel excruciatingly painful when your joints are inflamed. Most conventional treatments, anti-inflammatory medications, cortisone injections, and joint splinting, address the symptoms of these 3 processes without addressing the underlying biological drivers. This is why so many people get temporary relief, but the pain always returns. What we need is a daily nutritional intervention that works at the cellular level to reduce synovial inflammation, protect and rebuild cartilage in the small joints of the hand, and calm the hypersensitized nerves that are amplifying every pain signal. And that is exactly what this 3-ingredient morning drink does with remarkable precision and power. So what is in this drink? The hand and finger joint pain relief morning drink combines 3 specific natural ingredients: tart cherry, fresh ginger, and collagen peptides, each of which targets a specific biological root cause of hand and finger joint pain, and together create a synergistic healing effect that is far more powerful than any single ingredient alone. Let us go through each ingredient in detail, what it is, what the science says, and exactly why it belongs in this drink. The first and most remarkable ingredient is tart cherry, specifically Montmorency tart cherry, which is the variety used in virtually all of the clinical research on joint pain and inflammation. Tart cherries are one of the richest natural sources of anthocyanins, a class of powerful antioxidant and anti-inflammatory compounds that give the cherry its deep red color. But what makes Tart Cherry particularly extraordinary for hand and finger joint pain is not just its general anti-inflammatory effect. It is the specific mechanism through which its anthocyanins work that makes it so uniquely suited to joint inflammation. Tart cherry anthocyanins have been shown in multiple peer-reviewed studies to inhibit the same inflammatory enzymes, COX1 and QX2, that are targeted by prescription and over-the-counter anti-inflammatory medications like ibuprofen, naproxen, and celecoxib. But unlike these medications, Tart Cherry does this without the dangerous side effects on the stomach lining, kidneys, and cardiovascular system that make long-term NSAID use so problematic. A landmark study published in the Journal of Functional Foods found that participants who consumed Tart Cherry juice daily for 21 days experienced significant reductions in circulating inflammatory markers, specifically C-reactive protein and interleukin-6, the same inflammatory compounds that are most elevated in people with chronic joint pain and arthritis. Another study published in Osteoarthritis and Cartilage, one of the most prestigious journals in joint health research, found that Tart Cherry supplementation produced significant improvements in joint pain, stiffness, and physical function in patients with osteoarthritis. And a particularly exciting study from the Oregon Health and Science University found that women with inflammatory arthritis who consumed Tart Cherry juice twice daily for 3 weeks experienced a significant reduction in key inflammatory markers, with some participants reporting dramatic improvements in their hand and finger joint pain specifically. Tart Cherry also contains melatonin, which improves sleep quality, and tryptophan, which supports serotonin production. Since poor sleep dramatically worsens joint pain sensitivity and inflammation, and since serotonin plays a role in pain modulation, these additional compounds make Tart Cherry an even more comprehensively beneficial ingredient for anyone dealing with chronic hand and finger joint pain. The second ingredient is fresh ginger, and when it comes to synovial inflammation specifically, ginger is one of the most clinically validated natural anti-inflammatory agents available anywhere in the world of nutrition science. Ginger contains a family of bioactive compounds called gingerols and their heat-transformed versions called shogaols that work through multiple complementary anti-inflammatory pathways simultaneously. Gingerols have been shown to inhibit the synthesis of prostaglandins and leukotrienes, the inflammatory compounds most directly responsible for the pain, swelling, and stiffness in inflamed synovial joints. They also inhibit the NF-κB inflammatory pathway, one of the master switches of chronic inflammation in the body, which is particularly relevant for the persistent low-grade synovial inflammation that drives chronic hand and finger joint pain. A double-blind, placebo-controlled clinical trial published in the journal Arthritis and Rheumatism, one of the most rigorous study designs in medical research, found that patients with osteoarthritis of the hand who received standardized ginger extract experienced significantly greater reductions in hand pain and hand stiffness compared to those who received placebo. The researchers noted that the anti-inflammatory mechanisms of ginger were particularly effective in the small joints of the hand, which is exactly the target we are after with this morning drink. Another study published in the Journal of Pain found that daily ginger consumption reduced muscle and joint pain by 25% over an 11-day period, and that the pain-reducing effects were cumulative, meaning they built and strengthened with consistent daily consumption rather than plateauing. Ginger also has the remarkable ability to improve circulation to the peripheral tissues of the hands and fingers, which is critically important for joint healing because adequate blood flow is essential for delivering the nutrients, growth factors, and immune cells that your joint tissues need to repair and regenerate. Many people with chronic hand and finger joint pain also experience poor circulation in their hands, cold fingers, numbness, and sluggish healing, and ginger's circulatory benefits address this additional component of hand joint health powerfully and naturally. The third ingredient is hydrolyzed collagen peptides, and this is the ingredient that makes this morning drink not just a pain reliever but an actual joint rebuilder. Collagen is the primary structural protein in your cartilage, the smooth, protective tissue that lines the surfaces of your hand and finger joints and prevents bone-on-bone contact. As we age, our natural collagen production declines dramatically. After the age of 40, collagen production falls by approximately 1% per year, meaning that by the time you are 60, your body is producing roughly 20% less collagen than it was in your prime. In the small joints of the hand, which are under constant mechanical stress from the hundreds of gripping, pinching, and typing motions you make every single day. This collagen deficit shows up as thinning cartilage, increasing joint space narrowing, and progressive pain and stiffness that worsens with every passing year. Hydrolyzed collagen peptides, which are collagen proteins that have been broken down into small, highly bioavailable fragments, address this deficit directly and powerfully. When you consume hydrolyzed collagen peptides, they are absorbed into your bloodstream and selectively deposited in the cartilage tissue of your joints, including the small cartilage-lined joints of your fingers and hands, where they provide the raw structural material your joints need to repair, rebuild, and maintain their protective cartilage layer. A clinical study published in the International Journal of Medical Sciences found that patients with hand osteoarthritis who consumed hydrolyzed collagen peptides daily for 24 weeks experienced significant improvements in hand pain, hand function, and grip strength compared to placebo. The researchers found evidence of actual cartilage regeneration in the finger joints of the treatment group, meaning the collagen peptides were not just masking pain but actually rebuilding the damaged joint structures causing it. Additionally, collagen peptides stimulate your body's own collagen-producing cells, called chondrocytes, to increase their natural collagen synthesis. This means that daily collagen peptide consumption creates a double benefit, providing both the external structural material your joints need and stimulating your body to produce more of its own collagen internally. This regenerative effect is what makes collagen peptides such a powerful long-term solution for hand and finger joint pain rather than just a temporary pain reliever. Now, I want to stop right here and share a story with you, because the science we have been discussing becomes so much more meaningful and real when you see it transforming an actual person's life. Aaron is a 63-year-old retired piano teacher from Boston, Massachusetts. Music had been the center of Aaron's entire life for over 4 decades. He had taught piano to hundreds of students, performed in dozens of concerts, and spent thousands of hours at the keyboard over the course of his career. When he retired at 60, his plan was to finally have the time to play for pure joy, to sit at his piano every single morning and play whatever he wanted for as long as he wanted without the schedule and obligations of teaching. But life had a different plan. Within months of retirement, Aaron began experiencing severe pain, swelling, and stiffness in his finger and hand joints that made playing piano, the thing he had loved and lived for his entire adult life, genuinely impossible. His knuckles swelled visibly. His finger joints ached constantly. The morning stiffness was so severe that it took nearly 2 hours before his hands felt functional enough to do even basic daily tasks. And sitting down at his piano, the piano he had owned for 30 years, had become something he avoided because the pain of trying to play was too heartbreaking to face. Aaron saw 3 different specialists over the course of a year and a half: a rheumatologist, an orthopedic hand specialist, and an integrative medicine physician. He was tried on 2 different prescription anti-inflammatory medications, one of which caused significant stomach problems that led him to stop taking it, and one of which provided moderate relief for about 6 weeks before its effectiveness seemed to diminish. He received 2 cortisone injections in his most severely affected finger joints, which each provided about 4 weeks of meaningful relief before the pain returned to its previous level. He wore compression gloves at night, he did hand exercises every morning, and through all of this effort and expense and hope and disappointment, he never sat down at his piano because his hands never got well enough. It was Aaron's daughter who came across research on tart cherry, ginger, and collagen peptides for small joint inflammation. She had been searching online for natural approaches to hand arthritis and had found multiple clinical studies supporting this specific combination. She put together the exact morning drink recipe we are about to share and brought it to her father with one simple request: try this every morning for 14 days before you decide it does not work. Aaron agreed, not because he was particularly hopeful, but because he had nothing left to lose and his daughter had asked him to try. He started the drink the very next morning. For the first 5 days, he noticed nothing significant beyond a very slight reduction in the intensity of his morning stiffness. By day 8, something caught his attention. He was opening his morning pill organizer, a task that usually required significant effort and caused noticeable pain, and he did it without thinking. Quickly, easily, without pain. He stopped and stared at his hands for a moment. By day 11, the swelling around his knuckles, which had been visible and constant for over a year, had noticeably reduced. His wife commented on it before he even mentioned it to her, and on day 14, exactly 14 days after his first glass of this morning drink, Aaron sat down at his piano for the first time in nearly 2 years. He played for 45 minutes, not without any discomfort, but with enough freedom and enough function that tears ran down his face while he played. He called his daughter that evening and could barely speak. He said, "I played today. I actually played today." Aaron has continued this morning drink every single day for 7 months since that first glass. His hand and finger joint pain has reduced by what he estimates is approximately 80% from its worst point. He plays piano for at least an hour every single morning. He recently performed at his granddaughter's birthday party, something he had told his family he would never be able to do again. And he makes this 3-ingredient morning drink the very first thing he does every single day before he does anything else, because he knows with absolute certainty what his mornings look like without it and what they look like with it. Now let us talk about exactly how to make this drink so you can start tomorrow morning. The recipe is beautifully simple. The ingredients are widely available at any grocery store or health food store across America, and the entire preparation takes less than 3 minutes from start to finish. You will need 1 cup of pure tart cherry juice, specifically Montmorency tart cherry juice unsweetened, which is available at most Whole Foods, Trader Joe's, Walmart, and major grocery chains across the country. You will need 1 teaspoon of freshly grated ginger or half a teaspoon of high-quality ginger powder, and you will need 1 tablespoon of hydrolyzed collagen peptide powder, grass-fed, third-party tested, which is widely available at Costco, Amazon, GNC, and most health food stores. Combine all 3 ingredients in a glass or blender, stir or shake thoroughly until the collagen powder is completely dissolved, and drink it immediately on an empty stomach first thing every single morning before eating anything else. Drinking it on an empty stomach maximizes the absorption of all 3 ingredients, particularly the collagen peptides and the anthocyanins from the tart cherry, and gives your hand and finger joints the full therapeutic benefit of every single component. A few important notes on ingredient quality. When buying tart cherry juice, always choose 100% pure Montmorency tart cherry juice with no added sugar and no other fruit juices blended in. Many products labeled as cherry juice are primarily apple juice with minimal cherry content and will not produce the clinical benefits we have discussed. When buying collagen peptides, look for products labeled as hydrolyzed or type 2 collagen. Both have strong evidence for joint health, and choose brands that are grass-fed, non-GMO, and third-party tested for purity. When buying ginger, fresh is always best for maximum gingerol content, but high-quality organic ginger powder works well as a practical daily alternative. The key to getting results from this drink is absolute daily consistency. You cannot drink it for 3 days, skip 2 days, try it again for a week, and expect the results that Aaron experienced. The anthocyanins from tart cherry, the anti-inflammatory compounds from ginger, and the structural rebuilding work of the collagen peptides all require consistent daily presence in your system to build and sustain their therapeutic effects. Commit to 14 days at minimum, ideally 30 days, drink it every single morning without exception, and pay close daily attention to your hand and finger pain levels, your morning stiffness duration, and your grip strength. Most people begin noticing meaningful changes between days 7 and 14, with continued improvement building over the following weeks and months. Pair this morning drink with these additional habits for even faster and more dramatic results. Apply warm paraffin wax therapy to your hands for 15 minutes each evening. Paraffin wax therapy has strong clinical evidence for reducing hand joint pain and improving range of motion in people with hand arthritis, and is available as affordable home kits at most pharmacies. Do gentle hand and finger mobility exercises every morning after your drink, slowly opening and closing your fists, gently bending each finger individually and rotating your wrists to maintain joint lubrication and prevent the progressive stiffening that comes with inactivity. Add omega-3 rich foods like wild-caught salmon, walnuts, and flaxseed to your daily diet to complement the anti-inflammatory effects of your morning drink. And stay consistently well hydrated throughout the day. Your synovial fluid is primarily water, and adequate hydration is essential for maintaining the lubrication your hand and finger joints need to move comfortably and freely. The bottom line is this: hand and finger joint pain does not have to steal the things you love. It does not have to take away your ability to grip, to hold, to create, to connect, and to do the everyday tasks that give your life meaning and independence. This 3-ingredient morning drink, tart cherry, ginger, and collagen peptides, is not a miracle cure, but it is a powerful, science-backed, natural tool that addresses the actual biological root causes of hand and finger joint pain at the cellular level. Aaron got his piano back with it. 14 days, 1 drink every single morning. The same is possible for you starting tomorrow. Now, before you go anywhere, drop a comment below right now and tell me your age and the city you are watching from. And tell me, what is the one thing that your hand and finger joint pain has taken away from you that you want back most? I want to hear your story. I read every single comment personally, and your experience gives hope to everyone else in this community who is dealing with the same pain. And if this video gave you something valuable, if it gave you hope, a plan, and a reason to believe your hands can feel better, please share it right now with someone you love whose hands are hurting. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your hands because they connect you to everything and everyone that matters most in your life. This video is intended for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information shared is based on publicly available scientific research, peer-reviewed clinical studies, and general wellness and nutritional information available at the time of recording. The patient story featuring Aaron has been included for illustrative purposes only and reflects experiences consistent with existing clinical research on tart cherry, ginger, and collagen peptides for joint health. Individual results will always vary significantly based on age, overall health, severity of joint damage, underlying medical conditions, current medications, lifestyle factors, and other personal circumstances. Tart cherry juice contains natural sugars and should be consumed with caution by individuals managing diabetes or blood sugar conditions. Ginger may interact with blood-thinning medications, including warfarin. Collagen peptides are derived from animal sources and may not be suitable for individuals with certain dietary restrictions or allergies. Always consult with a board-certified physician, rheumatologist, orthopedic specialist, registered dietitian, or other qualified licensed healthcare professional before making any changes to your diet or supplement routine, particularly if you are managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the United States Food and Drug Administration. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease or medical condition. Never disregard professional medical advice or delay seeking appropriate medical care because of content you have watched online. Viewer discretion is always advised.